care for tuberculosis, because of the nature of the disease itself, people are required to be isolated. They are required to be put away from other people. And by doing that, we intend to contain the infection so that it can spread to other people, because TB is contagious, right? But we've seen from our scientific knowledge and clinical practice and everything that people with tuberculosis oftentimes also have other serious mental health conditions, and these people need to get treated. But think about it. If we need to bring in people with TB in the mental home where we're treating people with mental illness, what do you make of that? There's a trouble, right? So on one end, we have an infectious disease that we have to treat, and usually put put the people aside so we can contain infection. But then these same people also have some serious mental health issues, and they have to get treated. So how then do we go about this? Now, on the flip side of it, people with mental health problem also, depending what kind of mental health condition, they also have increased risk of TB, tuberculosis. So you see that there's a serious connection between tuberculosis and other mental health problems. And the Ministry of Health is supposed to provide health care for everybody.
Of course.
So now we started thinking, how can we make this work better? Because we can't move the people with TB in the mental home to treat them. Meanwhile, if someone has serious mental health condition and we need to treat the TB too, is unfair to just put the person away and say, go treat the TB when the TB finish before we do your mental health treatment. So this TB Reach program is intended to integrate the service for people with tuberculosis as well as the service for people with mental illness. So it is this integration that we are doing currently. And our partner, Carter Center, has been very instrumental in making this work.
Okay.
So it was the project that we drafted, the Carter Center and the Ministry of Health through the TB and leprosy control program and the mental health unit drafted the program and started rolling it out to see how it will be. I know some of our colleagues will talk more about the successes we've had, but this is the idea behind this TB Reach program.
And I just want to leave you there and jump straight to Carter Center, since indeed there is this direct link, since in fact Carter Center is the one now who has agreed to bring this integration together. Let's hear from you, Carter Center. What are you doing as part of this effort?
Thank you very much. And so let me also say thank you, Dr. Zia, the second.
Emphasizing his second.
Yeah. And so so if you look at the interconnectedness of TB to that of mental illness and substance use problem, by itself is an innovation. So with Carter Center's years of experience in mental health, sector, and the ministry's own experience in the integrating TB with other conditions like HIV and other areas, they found the experience to work together to see how they can come together with their expertise and their resources, and see how we can increase or improve services for people with mental illness, people with substance use problems, and people with TB. So in our approach, we design a strategy called one-stop shop approach. So in this approach, we're trying to limit the turnaround time for care to be provided, for a client who has these multiple conditions, or what we call comorbidities. In the past, you had somebody treated here for TB and they got to be referred to another facility somewhere else. They have to travel somewhere else to go seek for mental health, or mental illness, for care for mental illness. And that alone was dropping, some of our clients away. Imagine just telling somebody to leave from Dupolo and go to TB and they get missed, they get lost in between there. So this time around, we are integrating the services. So what we did was to do cross-training for clinicians. So people who are already clinicians who were already trained in mental illness or mental health, we train it, in the care of TB, and vice versa. People who were already TB clinicians, we train them in providing some kind of mental health services. So in that way, that one person, like she sits here now, she's able to provide care for person with TB who may develop a mental problem like
Okay.
depression. She doesn't have to refer that person now to another facility. And through that process, we see that there are a lot of success. I mean, our clients are adhering to treatment. The treatment success rate is improving based on our data we're getting now. We are seeing that even stigma on these people, we're seeing some level of, low level of stigma against people with TB and people with mental illness because of the number of people coming now, to seek for care.
So if I'm understanding you, it's not like getting a specific facility where someone that's suffering from tuberculosis and also a mental health problem will be treated, but it's instead you train somebody who can, of course, take care of someone with mental illness and tuberculosis in one facility.
In one facility.
Okay.
Yes. And so what we did as part of that process, we had to map out all of the facilities in Mosovado County that were already providing TB services.
Okay.
So we realized that there were somewhere around 20 something. And we also identified those facilities that had 3 mental health clinicians. So we topped up that number and it went up to 46. So we said, good, we can start with this. So we train people from all of the 46 facilities in Mosovado County, both rural and urban Mosovado. Now they are providing these services there. Yeah.
And I'm really enjoying my guests this evening because we have someone from the TB Honest who probably has the integration of the mental health and the tuberculosis there, and we have someone from the mental health facility who's also operating the integration of that. But let me come to you, Madam To. You are operating at a mental health facility, and you just heard from your colleagues from Carter Center and that of the Ministry of Health on what they have done to help your work and improve, because I'm sure had it been in the past where you were only dealing with somebody with mental health and facing the problem of tuberculosis, there was going to be a problem. But how is it now with you? How is your work going on since the involvement of the Carter Center, especially with this project?
Okay, thank you. So with the involvement of the integrated program at ES Green Mental Health Hospital, it has helped a whole lot, most especially our clients who are now screened for TB. If they are presumptive, we send them to the TB Honest where they will be tested, and if they are positive, then they will be treated there. So, and the community has an important role to play
Of course.
in the management of people who are living with TB. But the community is also responsible to be in the diagnosis, the treatment, and the ongoing care of person who is living with TB. They are also responsible to disseminate TB prevention information as well as risk reduction information. Because with the community, they will be able to disseminate the information in an easily understood language that people can be able to understand. And the community also help to participate whenever we go out to do a TB screening. The community participate in the TB integrated program where they come to a Pacific site where the TB clinicians, the mental health clinicians are there, and they do TB outreach. The integrated program, they do TB outreach there, and they come and they are screened, and they are coming from different areas. Some are from the ghetto, some are from the community, and they are screened. So the community plays an important role in ES Grant. We are very, very happy that this program is at ES Grant.
But the point is, you just spoke about community outreach, but say, for example, someone is a community chairman or a community leader, and this person has no idea at all what TB is, how it affects people. What is the connect between TB and mental illness, and we all just in the community passing around. So I'm sure it might be part of your outreach And I don't know so
Yes,
far
we,
how communities, how many communities you have reached, but it should be part of that to let these people know in the community the importance of all of what
yeah,
you just.
awareness is ongoing.
Okay.
Yeah, the Cattle Center is doing that. They are doing awareness, and they have the TB clinicians who are doing awareness in the community, and they are doing health education as well. So if you hear the news and you will tell your next person that, oh, the TB outreach group was here today and they gave an education on TB, so you will be on the alert that if anybody in the community, they will also give those signs and symptoms that you will see within a person that will make you to say, oh, this person is having TB, or this person is having another condition. So the community will be aware, and they will give out the information that will make the community chairman, the community members, that whenever there's an outbreak or there's an alert, they can be able to send the person to TB Annex, or telephone number will be available that the community can also call.
Okay, so we would surely take that telephone number because this is something very important. Let's hear from Madam Tupa, who's from the TB Annex. Madam Tupa, sometimes when people hear about TB Annex, they take it as a taboo facility, and you there dealing with all of those people that go in there, and hearing today that there is this serious connect between tuberculosis and mental illness. I can just imagine what you people been going through over the years before the coming of this program. How has it been?
Thank you very much. It has been a very tough time for us, because when the people are brought to the hospital, we do their tests, and they are found diagnosed of TB, we place them into care. But when they are on care, when they are in care, they will leave the facility, especially where they have been addicted to the drugs. They will leave the facility and go back to the ghetto.
So this one, you're just talking about the addicts, right?
Yes.
Okay.
So when they stay there for some times, after taking in the drugs, we found out that they will start coming down with distress, respiratory distress. They will have to come running back to the facility. At times, their friends will put them on back and even bring them. When they bring them, they charge them down and start to run back. We have to put them back inside the building and put oxygen on them before they can come to themselves.
Wow.
Yes, at times, those are already on OPD level, taking their medication now. They will continue taking in the drugs because they are already addicted to the drugs. And when they are in distress, their family members or friends that are around will rush them back to the hospital. And at times we try, but we end up losing them. So it has been a challenge. It has been too heavy for the facility because we don't always have current. At times when current goes, when they are there in distress, we have to use the oxygen tank, which is the cylinder. But when we have current, we use a concentrator. Yes, so if the tanks are not available, it will give us tough time.
And you just talking about the people, addicts, right?
Yes.
People who are on drugs and coming to the facility for treatment, leaving because they just want to go and satisfy their craving.
Sure.
But I'm thinking about the facility because looking at the number of people we have today, I'm not sure all of them are diagnosed with tuberculosis, but looking at the number of people we have on drugs today in the country, and probably just take a certain amount from them that will be diagnosed with tuberculosis and coming at that facility, is that facility capable enough to handle the influx of patients as we speak?
No, the facility can't accommodate everybody. So most of them are placed on OPD level.
OPD meaning that they just come
outpatient department.
Okay, come to
Yes,
treatment.
they come, they get a drugs and go home with it. They come on a Monday basis. But when they are starting the treatment, we give it to them every 2 weeks. The first time we give it to them for 2 weeks. When they come back, because we want to monitor them. When they come back, we give another 2 weeks. and we know that they are really adhering to the treatment, then we can make it to 1 month.
Mm.
And after the 1 month, when they come back, we do the test. If they are negative, then we know that they're already taking their medication.
Mm.
Yes, because if they are not taking it, they will not improve, they will decline.
Of
They
course.
even end up coming down with resistance.
So what about those who are not, addicts? Because I know there are people who have tuberculosis.
Yeah.
They are not addicts, but then they come to the facility as well for treatment. How are they too? How are you handling them? How are they responding to treatments and all of that?
Well, those people, they respond very fast.
Okay.
Yes, because they are held to their treatment. When you tell them to take the medication 5 a.m., they make sure they put their phone on alarm, and when the time reaches, they wake up and take their medication. So when they come, at the end of the first 2 months, when we do their tests, they are always negative. Those kind of people, you've hardly find them coming down with resistant. But for the others, most of them come down with resistant cases.
Are many people today being diagnosed with tuberculosis?
Yes,
Hmm.
because tuberculosis is an airborne disease.
Okay.
Yeah, it's an airborne disease. So anybody can come down with it because it's already an infected person put it in the air, and anybody inhales it and can come down with TB. Yes, so
Madam Tokwa, I will just stick with you a little bit more because probably someone just don't know the symptom of this tuberculosis. Probably they are somewhere and this person has tuberculosis, but they just don't know the symptom and when they should come and start to seek medication. Can you give us a minute of or two of education of how do you notice the symptom and you know that, okay, I have tuberculosis, or what I'm experiencing, I need to go to the maybe TB annex or go to the clinic for treatment?
you will not say you have tuberculosis or one has tuberculosis until the test is done.
Okay.
Yes. So
But is there anything
the
you
signs
can-
and symptoms, the person will start to cough, productive cough, weight loss, sweating at night,
Okay.
fever, loss of appetite, and sometimes chest pain, and so on. And then when someone tells you that, it's not diagnosed yet, so you can't say TB.
Okay.
It's presumptive. So the person will come to the test, to do the test. You invite the person over. For instance, if I went to get awareness, I will tell you when all these things happen to someone, they should come to do the test. If the test is done and they are diagnosed, then we can enroll them into care. But not just seeing someone reducing, they say you lost weight and you coughing, so you got TB. No.
Okay.
A lot of problems conditions can make you to cough.
Okay. All right. So let us just take this break. We will come back and continue with the discussion here. Let's take this break and be right back. Okay, so thanks for being there. Thanks for rejoining us. We're still here talking to the folks from Carter Center, and we're talking about this problem It's a problem. It's a health problem. Tuberculosis, mental health, coming together. What the Carter Center, the government of Liberia, and other facilities are doing to help people involved, people diagnosed with such problem. So we will come back to Dr. Zia and to tell us a little bit more, because you explained from the onset, about this someone with tuberculosis also suffering from mental health. But as a mental health expert, we will just sit a bit and listen to you to tell us why is this occurring.
Okay, let's start with tuberculosis. People with tuberculosis, they develop a chronic disease. Chronic means it takes long time for it to get better. All right, so they are required to be on long-term treatment. That is, if they start treatment. If they don't start treatment, that tuberculosis will linger around for a long time. All right, and physically it affects their body, the way they look. You know that people with TB, we can say in our common English, they get dry. You see them looking really dry. So when you see dry people, you hear people saying, "You look like TB patient." Exactly.
You're right.
Exactly. So when people have tuberculosis and they haven't started treating it, eventually they will lose weight and they will become that lame. Imagine if you become that lame, other people trying to stay away from you. It is stigmatizing. So people with tuberculosis, because of the stigma, they are likely to start worrying about their condition. They are likely to be put aside from other people out of fear. Other people just, they say either you look like AIDS patient or you look like TB patient. So they don't want to affiliate or associate with you. That alone is stigmatizing, and it breaches, the ability to socialize. And for our mental well-being, socialization is key. If you find out that everybody just call off from you and don't want to affiliate with you, you will have a mental health issue. So that's one link. That's one aspect. Second, the fact that tuberculosis itself is a chronic disease. When you're sick for a long time, you are worried about your health. And so worrying for a long time, especially excessively, where you're not seeing solution, can cause you to develop what we call anxiety, too much worry. So you can develop another type of mental illness called anxiety, right? And the first one I mentioned, when you put aside, eventually your mood might get low, you may feel sad and everything. And at the end of the day, you may get depressed. That's a common link. Now, even if you start to get treated, some of the medications that are used to treat people with TB, it can make your mood to get low, meaning it can make you like you're not happy, like you're feeling too sad. And when you feel too sad, they say too much of everything a problem, right? When you feel too sad, that's also a problem. It leads to depression, which is another form of mental illness. Okay. Some of the medications too that people use to treat TB can lead to other form of illnesses, other form of mental illness we call psychosis, wherein maybe the person hearing voices and nobody talking, or the person seeing things, nobody there, but they're seeing it, you're seeing people and nobody there. Or maybe the person start accusing people that somebody doing bad to them. Meanwhile, nobody got time for them, right? So this is one of the most serious form of mental illness we call psychosis. It is characterized by people losing touch with their environment, like things around them don't seem real. All right. So there's a direct link too with people who have tuberculosis. All right. That's just few examples, right? Let's flip on the other side. People who have mental health problems. Now, the particular group of people with mental health problems who are really at stake or at higher risk of TB are the people who have what we call substance use disorder.
Okay.
So these days, by the way, we let to call the people drug addict. It is stigmatizing. We have discovered that drug addiction is a brain disease. So in order to reduce the stigma, we don't say drug addicts. We say people with substance use disorder.
Okay.
So we always have this language. We say use people first. For example, we can say hypertensive, or you get hypertension. So we describe you as hypertensive. It is not good. It's stigmatizing. So we say people with hypertension, people with diabetes. people with mental illness. All right.
Okay.
So we can reduce the stigma because these are people with conditions.
Of course.
It's not a condition that makes the person right. It's actually someone who is suffering a condition. So we say people with mental health, people with substance use disorder. These people are at serious risk of developing TB. And let's just walk through how that happens.
Yeah.
All of us here, if anything happens to us that reduces our immune system, many of us will come out with TB. Because some of the people we interact with, walking the street, going to hospital, getting the taxi, all those people we interact with, some of them have other form of infectious diseases, including TB, that we could contract easily. But why don't we contract TB all over the place? That is because our immune system, meaning our soldier, the guard for our body, is strong enough. So it's keeping us safe. So if there's anything that breaches that gap or that suppresses our immune system, then people get TB easily. So how does this apply to the people with substance use disorder? One, these people are not eating well. Their whole life they were substance. So malnutrition. When you're not eating well, now the food we eat from the grains, from the bitter ball, all these things we eat from, from the different type of food, they build the immune system. All these small nutrients build the immune system. So if you're not getting those nutrients, what happens? Your immune system is not built well enough. So your immunity will go down. That is malnutrition, right? And when your immunity goes down, remember we said you are likely to have the TB because your immune system is what is preventing you. Okay, people with other forms of mental illnesses who, for example, wandering the street, the same nutrition thing, they're not eating well, and then they're in polluted places and all the kind of things. So
even though they're not on drugs,
some of them are on drugs. Yeah. So
yeah.
you see where the whole thing comes together: mental illness and substance abuse. All right. So other people with mental health conditions can also have issue with immune system problem. Think about it: a lady who's wandering the street, some people can go rape them. From time you can see pregnant, how you call it, people in the street, ladies in the street getting pregnant from time to time. It's because men are raping them. All right. So you imagine somebody who's vulnerable. She's prone to developing other form of infectious diseases like what? Like HIV. And we know HIV is one of the most common causes of suppressed immunity. So that's a mental health problem that's leading to someone developing other diseases that now put them at risk of developing TB because their immune system down. The guys who are in the street also, as they smoke for a long time, their lungs actually develop a problem. And lung problem alone predisposes people to TB again. So that's a direct risk also. Then think about them. I don't know if you've ever been to the ghetto.
I've been to many
ghettos. If you went to some of the common ones, Zimbabwe, Peno building, for example, do you see how the guys live? They are in clusters, huge cluster. And sometimes because they don't have money, when one person buy something, they cover themselves under the blanket and then they chase it and then they inhale, right? And you imagine somebody or a few people in that group got TB and they are in that cluster. So that is huge. Then think about our young women who have substance use problem. The way they find money to buy drugs is to sell their body. Sometimes they directly sell their body to the drug dealer, depending on who the person is, or they use their body to get money to go buy the drug. Now, they are at increased rates of what? HIV, hepatitis, and so forth. Now, these conditions, when you have them, they reduce your immune system. All of what we've described is putting you at risk of serious other diseases, including TB. All right. So, as the Ministry of Health, we see that the service we deliver has to be wholesome. We can give it in bits and pieces. Now, what is the actual advantage of this project? Before, people specialize, in healthcare. People specialize. Like you got the area that you are focused. So for me, I'm a mental health, professional, right? I'm a psychiatrist. But fortunately, I'm a medical doctor first before I'm a psychiatrist. So I have some broad base. Same thing with the nurses. Some of them, all of them train as nurses first, so they got baseline information, but it's not specialist information, right? But then you've been assigned to TBNS, and your whole work you're doing is around TB management. So all you know is TB. You drink TB, you eat TB, everything is TB for you. That's what you know. If you're a mental health professional, like she's a clinician. What she does is mental health. She knows how to manage people with mental health problems and all of this. So when somebody comes to the mental health hospital, your major focus, because that's your specialty, you are more likely to focus on the problem they came with, and you are likely to forget
Yeah.
other
They
problems that the
more.
person came with. Same thing with them. If you're treating your TB, all you concern about the person taking my medicine on time, they come to clinic on time, I'm following them up, but then you may forget that there are other problems. What this project has done is to remind you that you are a nurse and you are treating the whole human being.
Okay.
So we train you so that every person who comes with mental health or substance use disorder, you screen them for TB. Screening means you take special time to sit down and ask questions for TB.
Okay.
If it's there, you get some report. Then you do the next thing. Same thing with the people who treating TB. When the people are there, you're treating the TB, take time and ask specifically about mental health problems.
Okay.
And so through these screenings, you are likely to find it. They say when you look for something, you can find it. If you look for it, you are likely to never find it, right?
Of course.
So right now, this project is making sure that all our clinicians who are providing both TB care and both mental health care, they are looking for TB and mental health respectively, so that we don't miss anything. And by the way, this thing is being extended to other programs. Remember when I had a conversation, Jenna, talk about HIV, right? So the same way, people who are providing HIV care, they have to look for mental health problem, they have to look for TB problem, because those things are tied together. So that's the essence of the project.
And I know that this grant facility is right here in Pinsville on the Dupont Road, and the TB annex is in Congo Town. It's almost in close proximity. But I'm wondering, for the Carter Center, what are other facilities that you have this program spread across?
Thank you, and that's very important. And I think this is one of the reasons we're here, to tell our people out there, you can be any part of Montserrat County. Services are available throughout Montserrat County.
Nimba, Lofa.
We will come to that.
Okay,
yeah. So for in Montserrat County, if, for example, in Todi District, there are facilities there that we got 3, staff there. Gobatown, for example, Kunstown, Nyang Health Center. Those facilities are in Todi District, and they are providing the same integrated services we're talking about. In Kirisburg, for example, you got the Kirisburg, clinic. You got the military clinic there. I can send you where you got Cruiserville clinic. You got Benson Hospital there, and you got Harrisburg, and the rest of them. They are all providing the integrated services. And we talk about Monrovia here. We are trying to do this so as to decongest TB Annex. TB Annex cannot be the only facility to do that. They have been overwhelmed with too many cases. So we have extended this project now. You go, in fact, Duboro is one of our major facilities. The ERW Hospital, you got Cali Hospital, you got the John F. Kennedy Memorial Hospital, even the police training, the Central Police Station. Do you know that we have a clinic there? We did train, the staff there as well. They got some clinicians out there, and we train them, just like we did to Kansas City. Also at the Central Prison, we did train the clinicians there. They are also providing the integrated services. Like Dr. Zia was just talking about the intersection, between TB and mental health. Even if you were the one now diagnosed of TB today, just by the pronouncement of that diagnosis, you become depressed. I mean, it's just for few persons that will stand it, you become psychologically, imbalanced, and that can lead you to even run away, thinking that you are going to your uncle in the interior to seek care when you are actually spreading and going out, and we may not even see you again. So we are telling people, if you have signs of TB, like she listed some of them, if you are coughing, I don't even want to say 2 weeks or more. If you are coughing and that cough is coming out, services for TB are free. Get to some of these facilities and be tested. And if you are found to be TB positive, you can get your services right there. You don't need to wait on and be bedridden. I mean, when I say bedridden, you don't need to wait and be chronically ill. You are brought on motorbike or in car or keke. No, don't wait for that. I told the student all of the TB is a very lazy disease. I can tell anybody for free. Why do I say so? Why would we look? I've seen people who were chronically ill from TB, and after 2 weeks they got back on their feet and they went back. And we only continue with their treatment until for the rest of the other 6 months.
Okay.
Imagine the disease is very submissive to the drug because the drugs are very strong. It can't stand the drugs. So why would you die for TB? Yes.
And Julius, you have not told us about the other counties. You only mentioned, some facility in Painesville, especially.
Okay, so let me just be quick to help Julius out. Julius is not a Ministry of Health.
Okay.
Julius is from the Carter Center, which is a partner.
Okay.
And their project is mostly working in Monserrado. They have some
For
activity, yes, for now. And by the way, this is the start of the project, which is more like a pilot.
Okay.
So the goal is to test this intervention and see how effective it is. And so, yeah, we understand the science behind it that is going to work, but it is also cost intensive to do. So we started with the pilot here in Monserrado. It has some little activity
In Nimba.
in Nimba, some interventions, brief intervention, but the goal is to cement, the data that this thing works and it is the way to go, which we are already seeing. So the next thing now will be how can we cascade it around the country, and this is where the Ministry of Health comes in. So Carter Center as a partner cannot do everything across the country. So our partnership now has to extend to other partners who are already in the counties so that we can use the model that we've just, created that is working so that then Carter Center becomes more like a consultant for how we roll it out. So then we can talk to partners that are already in Maryland, for example. You're in Maryland, you're running activities there. So, okay, let's find out how you can integrate this other activity. So this is what we're going to be doing. But like we said, the start of the program is a pilot, and we are going to roll it out for sure. So hope is coming from the Ministry of Health.
Okay. All right. So let me just
and sorry, let me not make it seem as though services are not in the county. Let me be quick to clear that.
Okay.
Currently, around the country, there are health facilities, and truth is, people are getting treated for whatever condition they are presenting
tuberculosis.
with. Right, people are getting treated for
mental
tobacco.
health.
Exactly.
Yeah.
Okay, but just
This
that
is already happening across the
if-
country. What we're trying to do now, like he said, special hospital for TB, special hospital for mental health. It is troublesome. So the other person come with you, they want first, and before we see you. So what we are saying is we empower all the healthcare providers who are providing both services that look, when this person come to you first, do this, but find the problem and do this, which is what the project is doing.
So how many health workers we have already trained with this integrated?
Or the TB Reach program currently
We
has
155 clinicians,
right.
including supervisors.
155.
Yes.
yeah.
Okay.
So we will take this training eventually across the country and then roll it out and then make sure these integration works are being done. Then we go back to evaluate what is going on and see how we can improve and enhance some things.
Okay, so we cannot ask all of the questions now, but I just want to open the lines very shortly to have the public interaction. I'm sure someone somewhere has this pressing question or comment or recommendation to put through 0777-835-862, 086-616-580. We are here talking to health professionals from several institutions, from the Ministry of Health, from Carter Center, from the Grant, mental health clinic, and from TB Annex. They are all here talking about this integrated project known as the TB Reach project, where they are looking at people who are suffering from tuberculosis and at the same time mental health. We can take few calls and we call it a day on the program. Hello.
Yes, good evening. How are you?
We find here. Tell us your name, where you call from, and take a meaning.
This is Mr. Milton T.J. I'm calling from Painesville on behalf of Sumner County.
Welcome, Honorable T.J.
Thank you. Well, let me Thanks to your studio guests. I think they are discussing the issues in very simple English, and everybody seems to be understanding that. The concern that I have is the facilities that they are discussing on the radio, in my mind, seem to be very, very limited in some parts of the country. And they are overly available in Mosorado, specifically Mosorado. These facilities are very important. These services are very important. But from what I'm understanding, they are saying that they have the general service provider in the various counties that are providing these services on a minimum basis, in my own words. And in that way, it's hard for you to reach out to people who are actually impacted because, take for example, my own county, if you're in a place that they call Bupati or Jirepo, which will take you 3 or 4 days to walk to come to Greenville. If you have that kind of service, or if you have that kind of condition, you will have difficulty reaching to Greenville. Then you stay there, it will catch your son, it will catch your daughter, it will catch your grandchildren, then it becomes a major issue. So decentralization in my mind has to be considered as part of the way of dealing with these kinds of issues.
Okay.
But if we just keep everything centralized in Monrovia or overly available in Monrovia, it makes it difficult for our citizens in other parts of the country to have access to these services. But I just want to thank them for what they are doing because the clarifications are very, very important. Thank you very much.
Thank you very much, former Senator of Sino County, Milton TJ, making this contribution on the program, and he stressed the decentralization. But according to you guys, this is just a pilot project, and I'm sure there's plan for other counties.
Yeah. So like I was saying, thank you, Senator, for calling in. I think he made very salient points. The truth is that there are parts of the country where health services are not really up to what it's supposed to be. That is clear. That's a fact. What we're trying to do at the Ministry of Health is to bridge these gaps, clearly. But the TB and leprosy control program has services across the country in different areas. But the point we are making is that integration for people with mental health problems to receive care for TB if they tested positive, and people with TB to receive care for mental health conditions if they are already been treated in a place is what we are emphasizing.
Okay.
But there are mental health facilities, not as in we have mental health hospital, but people with mental health problems are seeking care around the country already. Is it better? I mean, can it be improved? Yes. But are there services ongoing? Yes.
Okay.
Also, same thing with TB.
Okay.
Yeah.
All right. We can take a few more of your calls on 0777 835 8620 866 and then we call it a quit on the program this evening. You've been following us. We're talking about tuberculosis and mental health. How can you get treatment when you are diagnosed with both of the conditions? And that is what we are talking about on the program today. So let me hear from you small, Madam Tukpa. How now are your patients at the TB Annex faring? Are you currently noticing, or have you interacted with anybody with both the tuberculosis and suffering from mental health problem?
Well, we have a lot of patients on the ward, meaning that at the facility now,
Okay.
that are substance users.
Okay.
Yes. Many at times we catch them with these substances in their pockets or even taking it in. Yes.
So let me, Dr. Zia, is substance abuse considered as a mental health problem?
Absolutely.
Yes, it
Okay.
is.
So automatically, once you are abusing the substance, then you are
You already have a mental health
mental
problem.
okay.
Yes. And at times, even before I could come here, I was caught on a resistant ward that a patient was caught with the drugs. So
I ain't got security there. How do people entering the building?
we got security, but at times I let the window pass something under the building, and then they will slink out. they go and come back, maybe take it in and bring some in for the next 2 hours.
Reserve.
So
The guys are hard to deal with.
it's a major challenge, but however, we are trying to talk to them because the mental health clinician there, she comes on every hour to talk with maybe 2 or 3 patients, and then come back and go on the other ward, talk with even the female. They are among the females.
Okay.
Mm-hmm.
All right.
They just how do you call it? Just attention too much on the TB honest compound.
Wow.
Yes.
Okay, so we are out of time now. We don't have much time, but we will just start with you again to have your closing comment and go across the table, Madam Tokpa.
Thank you. Well, I want to extend my thanks and appreciation to Carter Center because the integration will help us a lot. Yes. We received our drugs the other day that is trying to calm some of them down. Those have been in the facility for the past 2 weeks. We started to give it to them, and they are taking it every 2 hours, after every 2 hours. And I think it is working. But with those that are just coming and have not started it yet, they are still going out there. So we want to thank Carter Center, and we pray that it will work for us all to have positive results.
Okay.
Yes.
Julius?
Yeah. So for me, last week we had a patient here. I mean, we had a success story here from one of our facilities. This program will work.
Okay.
It can work, and I'm encouraging all those our people who are listening out there. You don't need to die from TB. If you have, even you, because of your condition, you have gone into mental, situation like depression and things. Speak to somebody out there in one of our facilities. You don't know your problems will be solved there. We're encouraging everybody, even parents, those of you who have relatives who may be coughing or who may have this situation, your support, your care, your concern for them will also help them to adhere to treatment.
Okay.
Together, we can defeat TB.
Okay. Madam To?
We want to encourage our people to seek treatment. They shouldn't be afraid. They shouldn't be afraid of the stigma. They should go to the TB analyst to seek treatment. And if any mental health issue attached to it, will be addressed also.
Okay. All right, Dr. Zia.
Okay, thank you to you for hosting us. Thank you to our partners, Carter Center, and all other partners who are involved with helping the Ministry of Health to deliver quality healthcare services to the people of Liberia. As a Ministry of Health, we have a greater responsibility, and we are committed to this. And all programs and interventions that will improve the healthcare delivery system, we're committed to incorporating them. So this program is one that we are definitely going to roll out, and we are grateful that Carter Center is already helping us to do this. We remain committed to working with more partners so we can implement more programs and be able to spread out interventions around the country so people can benefit. Thank you also to our listeners, and it has been a pleasure having us on the show.
Thank you so much. He's Dr. Moses Zia II from the Ministry of Health. You heard Juma Tokpa from TB Honest, Julius Gangawulu. So sorry if I'm not getting it right. He's from Carter Center, and Felicia Sato from the that's the FJ.
ES Grant Mental Health Hospital.
ES Grant Mental Hospital. They've all been here telling us about this TB Rich project, and that is carried out by the Ministry of Health and Carter Center, helping to treat people with tuberculosis and mental health at the same time. And let me say thank you to all of you for the work you do for our country, Liberia.
Thank you.
Okay, so on that note, we will be here again tomorrow with another edition of the Bumper Show. As you know, tomorrow is the abbreviated edition. So you can join us tomorrow for another edition. On behalf of the entire team, my name is Jab Davis. Wishing you all the best from the beautiful city of Painesville. Good evening and bye-bye for now.